This conference will now be recorded.
As you may have just heard, we are going to be recording this event, and I'll tell you more about the logistics in a minute. I just want to start with a brief overview of today's presentation. After the introduction, we're going to hear from former Washington State Representative Ruth Kagi, who was one of the leading forces in two major changes in the state of Washington in early childhood governance, one creating a Department of Early Learning, and then another creating a Department of Children, Youth, and Families. After that, we're going to hear from former Louisiana State Superintendent John White, talking about some of the changes that were made in Louisiana under their Act 3, which consolidated a number of important programs under the Department of Education. After that, I will go through a PowerPoint explaining a little bit more about our new report, Getting There From Here, which talks about early childhood governance and offers some suggestions for states that are thinking about it for how they might go about considering what is the best governance structure for their state. And then we will have reflections from Rebecca Gomez of the Heising-Simons Foundation, who supported this project from beginning to end and is herself a tremendous expert on early childhood governance. We will leave time for Q&A at the end. And we are encouraging people to do Q&A in the chat room. I will talk about that on 2 slides down. And Jamie, if you wouldn't mind advancing the slides, that'd be great. Today we would like it if you could make sure that you are muted during the conversation. Again, we would like very much to hear your questions, but we would like you to submit them in the chat. Jamie Brandon from Foresight Law and Policy, who I think is registered as Foresight Law and Policy, will be helping to keep track of all those so that we can moderate that at the end. As those of you who've been on for a few minutes heard, the session is being recorded. We will post that recording and also a brief summary of what transpired. We appreciate you being here with us today, but if there's any colleagues you want to share this with, you can share that with them. We are committed to going no more than 90 minutes, and if we wrap up sooner, that's okay too. But did want to leave time at the end for Q&A, and I assure you the presentations collectively will not go nearly that long. So with that, I would like to get us started, and for that, I will turn us over to Ruth Kagi, former Washington State Representative. Representative, please take it away.
Well, thank you very much, Elliot, for the opportunity to share some of Washington's history in governance and to share some of the lessons learned along the way. Washington has passed 2 major pieces of governance. Please enter your access code. In 2006, Chris Gregoire was a newly elected governor, and she proposed the creation of the Department of Early Learning after getting that recommendation from a broad-based commission she established on education reform. And the Early Learning Council of that commission recommended that the fragmented pieces of childcare, preschool, and home visiting be put together in a Department of Early Learning. So the bill submitted an executive request legislation to really focus on closing the opportunity gap and inequities, increasing kindergarten readiness, and establishing an agency that was really data-driven and outcomes-focused. The department would be headed by a director who would sit on a small agency cabinet and be able to give visibility and focus to early learning issues and resource needs. In January, I introduced the bill with bipartisan support, which was remarkable because the Republicans in both the House and the Senate had bitterly fought any effort to coordinate, much less consolidate, childcare and preschool. They really viewed the first 5 years as the purview of the family and did not want the state intruding. But it was, we were very fortunate to have NCSL, the National Conference of State Legislatures, give an early learning symposium in Seattle in the summer of 2015 before their convention. And we had presentations from the scientist, Dr. Pat Kuhl from the University of Washington about infant brain development, and Jack Shonkoff from Harvard talking about the impact of adversity, and Art Rolney talking about the economics of early learning and the very high return on investment. And we had a senator from Tennessee, a conservative state, who talked about the beer tax they had just passed to pay for a statewide universal pre-K program. So after that symposium, Representative Gigi Talcott, who was the ranking member on the House Education Committee, came up to me and said, okay, I get it. I want to work with you. And I can't emphasize enough the importance of that turn, because it has allowed us to develop an early learning system in Washington that has strong bipartisan support. It's built over the years, but we had a lot of help from the business community when we were creating the Department of Early Learning. Key business leaders talked with the leadership of both caucuses in the House and the Senate and convinced them of the importance of this bill. But there was tremendous resistance to creating a new agency, and that resulted in minimal appropriation with the new department being established, $1 million to create the infrastructure of a new department. So they were hobbled at the outset and faced a couple of other barriers. One being the programs being moved from other agencies. The new department had no say on who came over, and there were some less productive employees who were moved over by the agencies. And leadership matters. The first director of the department was not a good fit. So the department really struggled at the outset and really kind of fumbled out of the gate. But the governor appointed a new director, Betty Hyde, who was a superintendent of a public school and an early learning leader across the state and the nation. And she was really able to turn the department around and get it focused on its original vision and the steps that needed to be taken to reach that vision. We also had a lot of help from philanthropy. In the bill establishing the Department of Early Learning, there was also the creation of a public-private partnership, Thrive by 5 Washington, which was co-chaired by Governor Gregoire and Bill Gates Sr. It had legislators from all four corners on the board, as well as community leaders and some very visible and strong business leaders. And it launched with high hopes. When the state hit the Great Recession and the funding for implementing our quality rating and improvement system disappeared, Thrive by 5 stepped up and used private resources to pilot the demonstration programs for QRIS, and did the evaluation, funded the evaluation, so that we had a very solid foundation of information on what worked and how a QRIS should be structured for Washington, and were well prepared when the Race to the Top grant was made available and we were successful in getting a grant. Those resources really helped the department consolidate and launch a very robust quality rating and improvement system. In 2015, Betty Hyde retired, and the governor appointed Representative Ross Hunter, who had been chair of the Appropriations Committee for a number of years and was leading the legislature. So we had a very well-respected, strong leader and manager who took over the department and really took it to a new level. And as a result, the Department of Early Learning was gaining tremendous respect and was viewed as a success. And people really understood that the lesson learned from the department was that if you take fragmented pieces and put them together into a cogent whole, with a strong leader, you can accomplish tremendous change and improvement. At the same time that the Department of Early Learning was maturing, the legislature's frustration with our child welfare agency, the Children's Administration, which was located in the Department of Social and Health Services, was growing. The agency was remarkably unresponsive to the legislature and to just about any suggestion from the outside. And we were very concerned about the outcomes for foster children, which were pretty dismal. So as a result of that frustration, the governor appointed a Blue Ribbon Commission, which was a high-level commission with 4 legislators from each caucus, agency directors, judges, advocates, representatives from the systems that would need to have input in the formation of a new department, and outside experts on child welfare, early learning, and juvenile justice. And that commission, over 7 months, with the support of the Governor's Senior Advisory Council and consultants, developed a very strong consensus on a proposal to create a new Department of Children, Youth, and Families that would bring in the Department of Early Learning, the Child Welfare Agency, and Juvenile Justice Administration. And the vision of the commission and of the legislature was to really shift to a more prevention-focused agency that could provide support for children and families, so fewer children came into child welfare, and their journey through child welfare was more positive and short, and they did not progress into juvenile justice. So we fashioned a bill that was based on the report, and it again was focused on prevention, early intervention, also very focused on outcomes and improving outcomes, including racial disproportionality and the disparities that we saw starting with our early learning system, and to create an innovative data-driven agency. We actually recommended in the commission that an Office of Innovation, Accountability, and Alignment be established in the Secretary's office to assure that the department was research-driven and made decisions based on the data. And that was included in the final department. We had tremendous support, again, from philanthropy in getting the bill passed or in supporting the work that was done to get to that point. And we had strong support from advocates. There was concern on the part of the early learning advocates about the loss of the laser focus the Department of Early Learning had provided on childcare, preschool, and home visiting, and that focus would be lost. But the advocates also understood the importance of making these high quality opportunities available to the children and families who could most benefit from them and who were suffering the most in the state. So they did support the bill in the end, and I give them tremendous credit for that. The lessons learned from the Department of Early Learning were really applied in the creation of the Department of Children, Youth, and Families. Number one, we funded the infrastructure. We really recognized that if we didn't provide the resources, the department would not succeed. And really, in some ways, the Department of Early Learning was saved by the Race to the Top grant. The legislature never adequately funded it. Second, we phased in the implementation. So the secretary was appointed and had a year to develop an implementation plan. And then there was a phase-in of child welfare and early learning, and then a year later, a phase-in of juvenile justice. So it was a very carefully structured implementation. Third, we learned the lesson of the importance of appointing a strong leader manager for a new department. Ross Hunter was appointed to be the secretary of the new department. And he was well known and respected and had tremendous skill to bring to this very daunting task. And finally, we had, again, very strong support and help from philanthropy in the implementation of the department. Philanthropy helped the department reach resources for change management and data systems and all kinds of the infrastructure issues that needed a lot of expertise to develop properly. And philanthropy really stepped up and helped the department do that. So in summation, Elliot's report talks about trade-offs, and there definitely were a lot of trade-offs in the creation of the Department of Children, Youth, and Families. There have been real advantages in having a secretary in the governor's cabinet speaking to the needs of children and families and arguing for resources and policy. It's allowed him to work with other secretaries and cabinet members, and with OSPI, our education agency, to expand kindergarten opportunities. It has really leveraged more resources for children and families and given more leverage for those issues. The downside is that there are distractions. There is no longer a singular focus on early learning. There is no longer an agency you can go to with for early learning issues. It is diffused within the agency. But we have not seen a diminishment, if anything, an increase in the support for early learning. In the governor's budgets and in the legislature's budgets, the funding for early learning has increased dramatically since the department was created. So in closing, we've been remarkably fortunate in Washington. We've had two governors who've provided leadership and support for improving our early learning services. We have very strong legislative leaders and an expanding number of leaders who have early learning as their highest priority and work hard on it. We've had a robust and well-organized early learning advocacy community and strong support from philanthropy. That commitment and progress will obviously be challenged in the coming years with the depression or recession that we're going to be facing. But I do believe that the breadth and the depth of support in the legislature will allow us to continue to progress.
Thank you so much, Representative. And again, for those of you who joined while she was in progress, if you have questions that you would like for Representative Kagi to answer, please put those in the chat. We will be collecting questions in the chat for any of the presenters and then answering those at the end. And so with that, again, welcome to everybody who joined in the last few minutes. Thank you for joining us. Again, very excited to be releasing this report, even if the circumstances of the world are deeply challenging right now. With that, I want to turn it over to former Louisiana State Superintendent John White to talk about their experience implementing Louisiana's Revolutionary Act 3, which consolidated a fair amount of early childhood programming under the Department of Education. So, John, please take it away.
Elliot, thank you, and thanks to all of you for being here. And I actually think this is a fantastic time to release this type of report because it's we're in kind of a new world, and big ideas need to be taken seriously. And while as commonsensical as your ideas are, they're big, and I'm very appreciative of the chance to come and talk about them today. I also want to thank Representative Kagi for that story. Washington has been a leader. We've emulated a lot of the earlier work that Washington did in our own work in Louisiana, where I was state superintendent up until 3 months ago. So I appreciate the chance to present with you as well. I'll be brief in sharing the story, but let me just say at the start, Louisiana is a poor southern state that is still digging itself out of 300 years of oppression and bias and bigotry. It's a state that is digging itself out of a 19th century agrarian economic model. And so in a way, the focus on providing a high quality environment for young children to spend their days is really a building block in what I would call a kind of economic and educational modernization of the Deep South in Louisiana, as much as it is a kind of education reform. So I see it through that lens, that you'll never have a modern Louisiana in the absence of a high quality, trustworthy system of early childhood care and education. We are not even remotely there at this point in time. We still have absurdly and tragically low reimbursement rates for childcare, for example. We have relatively low enrollment rates in childcare. And frankly, that comes after years of political neglect as much as anything else. So I don't want to say that all is rosy in Louisiana. This is still a system that is not remotely where it needs to be. But we certainly have a better case to make for change now than we did 9 years ago or 8 years ago when we launched Act 3, as Elliot said. And I just want to emphasize that point, that in the absence of coherence, you do not have a credible case to make because you have no idea what's going on out there. You know, we have nearly 1 million kids in our education system, early childhood and K-12, and there's simply no way for a state to have any idea of the quality of their daily experience, of anything about their daily experience, of whether they're being served, why they are or are not being served well, if you don't have coherence. And the system of early childhood care and education, created in so many different pieces by states, by localities, and in particular by the federal government, was built in pieces. And it really is the obligation of the states in this moment, if you're going to make a case for change, especially if you're going to do it in low tax environments, to create a coherent policy framework that actually allows you some semblance of an understanding of what's going on. And so in 2012, we enacted legislation to give us a coherent system, to help us get a sense of what's actually happening so that we could talk about improvement, so that we could talk about growth. Because in a low tax environment, a legislature that's supermajority now, both chambers Republican, asking the legislature for simply more money to subsidize programs that were largely perceived as social welfare programs without any credible basis for saying this is what's working and what's not, this is where it's working and where it's not, this is even how much of the service is being provided and how much is not, how much of the population is being covered and how much is not, was just untenable. And so we set out to create a coherent governing environment, not totally unlike Washington's, that allowed us to create a performance environment, to actually have a plan and to enact it at scale because we knew what was going on. Probably the biggest lesson in doing all of this is that, as the Washington story illustrates, one piece of legislation does not a reform make, certainly not a governance reform, certainly nothing as ambitious as this. Meaning everybody likes to pass big bills, and I'm sure, you know, Representative Casey's been a part of that. I know, Elliot, you and when your time in Illinois were part of that. I was a part of that. Everybody likes to pass big bills, take one of the governor's pens, sign the bill, and be done with it, and then everybody leaves and goes home. But really what I hear in the Washington story, and it's certainly true in our story, was that a piece of legislation just kicked off. It created a framework for nearly a decade of subsequent work. And month after month after month, we were putting stuff to the test, and what worked we would codify in regulation, or we'd go back to the legislature and ask them for further legislation, and what didn't work we would discard. So the original legislation in Act 3 actually said something very simple. This was in the winter of 2012. Childcare, public pre-K, private pre-K, and Head Start should be a part of one system, governed by one body, held to shared minimum standards of excellence anytime a center or a school takes public funding. And that's all that it said. And it delegated to the Board of Education the ability to create regulations that over time evolved, almost evolved monthly, to create a more coherent system. We then began testing how that system could work. We piloted in roughly a dozen districts across the state, and I owe all credit for this to the brilliant Jenna Conway, who's now leading this work for the governor in Virginia, Jessica Bagian, who until recently was leading it in Louisiana, and the thousands and thousands of incredible child care center leaders and school principals that all made this work. But we began piloting a system that said, let's just start with measurement. And let's start with using the class instrument to measure classroom quality. Let's start with enrollment, And let's actually begin experimenting with the idea of what would happen if child cares, Head Starts, and pre-Ks all enrolled on the same timeline by way of a common application. Over time, those systems evolved. The number of counties, or we call them parishes, who were involved evolved. And we began to layer on other elements, such as requiring that teachers actually have a minimum standard of preparation on their own. And ultimately, we began to get more sophisticated as we built an understanding of what was working in our accountability system so that we can enact curriculum reforms. Over time, though, we became confronted with the difficult reality of, well, what happens when success centers don't work? And this framework of improvement, where you're talking about curriculum now and teacher training at scale and actually minimum adequate standards of funding across all different types of programs at scale, what if that wasn't working? What would you do? We went back to the legislature. We asked for them to give us the authority to use our licensure power to not just sanction and force corrective action, but if need be, revoke the licenses of centers that couldn't prove a basic minimum standard of developmental, academic, and social excellence in the environment and organizational excellence in the environments within their schools. All of which is to say that over time, we actually began to be able to demonstrate across thousands of centers in the state, rural and urban, in wealthy areas and in poor areas. We began to be able to demonstrate real academic improvement, real cognitive improvement, real social improvement, real organizational improvement in the care for children, birth to 5, on nationally normed instruments. And we began to be able to go back to the legislature then and make the case that us having accomplished what they asked us to accomplish in 2012, it's time to step up and start funding the early childhood system, even in a low tax environment like Louisiana, a conservative environment like Louisiana. And we began 2 legislative sessions ago, 2 years ago, to actually see that take shape. I don't believe that the additional funding that Governor Edwards, our current governor, put into the budget for early childhood education, that the additional competitive funds we won from the federal government over the course of the last several years ever would have been possible had we not been able to make a credible case that we had been able to implement by way of coherent governing structures, by way of minimum standards of excellence, and an actual line of sight into what's happening in the classrooms of child cares, Head Starts, and pre-kindergartens. We wouldn't have been able to make a case for additional resources, which is to say that I'm greatly envious of my colleagues in places like New York City and Washington, D.C., whose governments and taxpayers have, rightly in my view, stepped up to fund systems for middle earners as well as for low-income individuals in their jurisdictions. But the reality is that in most states, in most communities in this country, we are very far from a universally funded education system. And it's going to take a different case for change to get governments to step up and actually invest in the grade levels, the ages that need it most. And that's really at its essence why I believe coherent governance matters so much. In the absence of coherence, you have chaos. And when you have chaos, you have no credible foundation on which to advocate for change. We need to advocate for change and improvement. We need to advocate for increases in resources. To do either one of those things, you actually need to know what's going on. And that means starting with a coherent system of governance, measurement, and improvement. So Elliot, I thank you for calling attention to the issue. I've been grateful to have your guidance over the years, and I'm very grateful to be a part of this panel today.
Thank you so much. The Louisiana story is a very compelling one. Again, if you have questions for Superintendent White, put them in the chat. I saw that Professor Smith already has posted one question, which we will hopefully get to in the Q&A. And at this point, I'm going to walk you through the report that just came out last week, Early Childhood Governance, Getting There From Here. And to start, and this really picks up on what John was saying, there's a few things we know for sure. We know that the early years are developmentally important. We know that adult-child interactions in those first 5 years really matter. We know that program level characteristics of early care and education programs, we know how to design those programs to have a positive impact on children. That's some of the work John was talking about in class. And we also know that the data suggests that if children fall behind in the early years, it is very difficult to catch them up. So we know all that, but what we actually don't know nearly as well is what is the best way to organize ourselves at the state and local level to deliver high quality education at scale. And how do we connect early care and education to the full range of child development services, which include health services, other social services. So there's a whole bunch of questions there. And what it turns out is that the correct answer is going to vary from place to place. And that's a large part of what this report is about, is helping states navigate this ambiguity. So a couple of key terms that I want to flag on the next slide. One is governance relate, and a lot of these terms come from pioneering work done by Lynn Kagan, who was a huge help in the preparing of this report. One is that governance relates to the exercise of authority, right? Who has control, who has decision-making power. I also will refer sometimes to early childhood education and care. That is home and center-based services that are developmental and educational. Again, those of us in the field would talk about preschool, childcare, Head Start, and to some degree, IDEA funded services is falling in that category. It wouldn't necessarily include something, again, to Representative Kagi's point, like a child welfare system. That would fall under what we call comprehensive early development services. That includes a lot of those other pieces. So in doing this report, again, I'll talk about the process in a minute, but the report identifies some critical issues that states need to confront. And I'm just going to talk about them briefly here before going into them in more detail. I will note that while the full report is in somewhat imposing size, we did create a 4-page decision guide that really just rattles through these key issues very briefly and attaches some key questions for people who want to just have a handy guide to the issue, as it were. So first of all, it's really important for states to set clear priorities. You just heard from a couple of state leaders on what some of their priorities were. Establish a process for getting from point A to point B. As Superintendent White said, legislation is just the beginning. And you heard Representative Kagi talking about some of the processes that Washington used. Defining critical functions, right? What exactly do you want government to be doing? That's a step that sometimes people skip, but really thinking about what exactly are we trying to accomplish here is critical to do at the outset. And then to think about comparative advantage. What is the state likely to be good at? What are regional and local structures likely to be good at? How are you putting functions in a place where they are most likely to be successful? How do you make sure that the state has the personnel capacity to execute its role? Again, Representative Kagi touched on that. And then the question that I think is tempting for a lot of people to jump to at the outset, but that in my report comes a lot later, is how do you configure state capacity? Do you want to have a single agency? Do you want to vest authority in a standalone agency like Washington or an existing larger agency like Louisiana? The change management piece is huge. Again, you heard both Superintendent and Representative talk about that. And then at the end, it talks about some key considerations in deciding whether or not to actually go forward once you've talked through what all of these pieces might look like. So that's a brief overview to now go into a little bit more detail about each of them. In terms of setting key priorities, many states that have done governance changes in the past have had a couple of anchor priorities that have driven the work. Again, you heard Superintendent White talk about what some of them were in Louisiana and Representative Kagi in Washington. In general, some of the themes that came across from talking to multiple states are minimizing the burden on families, right? The families are navigating all of these different complexities. How do you create an agency that's responsible for helping make their lives easy? How do you make sure you have quality? How do you expand access to services? How do you improve efficiency, right? The sense that there are multiple different programs doing potentially repetitive services with repetitive capacity. And also, how do you elevate leadership? How do you make sure that there is someone who is a high-level voice for early childhood in the larger political ecosystem? One thing that is worth noting, a couple things worth noting for the here and now. One is that states have had in the last year preschool development grants from the federal government. Even states that didn't get renewal grants, almost every state had a planning grant through which they have done some strategic planning work. That can help identify some key priorities that can serve as the grounding for a conversation about governance. It's also worth noting that in this remarkable moment of COVID-19, that one of the things that has surfaced is that there are a lot of inefficiencies that in effect everybody just kind of got used to, that once a real crisis hits, become huge operational difficulties. And we had a couple of questions submitted in advance about this, so hopefully we'll get to that in the Q&A. But it is worth noting that I do think, as John White pointed out, that the fact of this crisis is forcing people to rethink how they want to do their business going forward, and that early childhood governance is one place where the inefficiencies may be smacking us in the face in a way that they, never did before. So on the next slide, it talks about how you establish a process. And again, you've heard different variants of this in the report. It makes some recommendations about key stakeholders who need to be engaged. And I do want to give a shout out here to my colleagues in both Illinois and Wyoming, who are in fact engaging in a process to talk about this issue, structured in a way very similar to what's discussed in the paper. The idea of getting key stakeholders around the table, particularly end users of the system, has some real value. There are obviously trade-offs in that, right? You don't want a 100-person committee thinking that it's designing the system, but it is important to get voices from the field involved, because they are the ones who are going to be living with the result, and the sooner you can get their input, the more likely you are to come to a workable result. This is definitely not easy, and there are a lot of different perspectives that need to be navigated. Some of the tensions, and this is not an exhaustive list, some of the tensions that were highlighted in the interviews I was able to do are one, inside-outside tension, right? There is a tension between the folks in state government and the folks outside state government about how state government ought to operate. Another is inside. Different agencies may have different perspectives. Different levels of leadership within agencies may have different perspectives. That's the intra-agency piece, right? Agency heads may have one view, and the division managers who are actually running programs may have a completely different one. That needs to be navigated. There is also a tension between change and the status quo. Even where everybody thinks the status quo is untenable, there are people who are invested in it in their way, and that is a force that needs to be reckoned with. It is easy to argue for change. It's another thing altogether to actually experience it. And this tension has definitely come up in a number of states that have wrestled with these issues. So on the next slide talks about the point I raised about critical functions. And there are certain functions that any state governance structure is going to need to be able to execute to be successful. And one of the major themes, and again, for this report, I was able to talk to almost 90 people from across multiple states, advocates, state government, and there are a few consistent themes that came through, one of which being that if whatever your governance arrangement is cannot successfully execute these basic functions, then it really doesn't matter how nicely designed it was. People in the field will experience it as a negative change. So those include managing funds, right? Particularly distributing funding and budgeting for that. Setting standards for and maintaining quality, right? Making sure that there are consistent definitions across sectors, making sure that someone's actually paying attention to how well those are being implemented, and providing support for providers to get better. Supporting professionals, right? Licensing, pre-service, and professional development. How are we elevating the field and helping professionals get more skilled? How do you engage families and stakeholders, right? There is an ongoing need to be hearing voices from providers and families. How is the state set up to do that? And there's also a communications and public relations function where the idea that the state can help educate people about the value of high quality early childhood services and about the benefits being achieved through the services that are being provided. Those are not the only critical functions, but those are some of the ones that came up most commonly during the process. So in terms of defining the critical functions, it's also important for states to think about the impact of administrative burden. And many of us who work in the field have heard plenty of stories from providers who feel like if they're taking, talk about that if they are getting money from multiple funding streams, they are filling out enormous amounts of paperwork, much of which feels overlapping. That burden has a real drag on the system, and the question of what can the state do to alleviate that. There's also a significant burden on families as they attempt to navigate toward the services they need. If different providers and different agencies are all funding this separately in an uncoordinated way, it can be very challenging to navigate, particularly given that by definition, we're talking about families with, in many instances, low incomes and with young children. That by definition means they don't have a lot of extra bandwidth to be dealing with all this. So there is a notion that programs should be simple and accessible, minimizing burdens while protecting the important values of accountability, and just making sure that the state is not pushing too much of that burden onto the folks least able to least able to deal with it. So on the next slide, we switch to the idea of comparative advantage. And this, I think, is an absolutely critical idea that, again, in some states comes naturally, in others is a little harder to talk about, but that the fact that the state is leading in this area does not mean that the state should be doing the entire job itself. So in thinking about the basic functions, the question of what are some of the ones that really belong at the state level, what belongs at the local level, and the two overarching questions I suggest asking are, what are functions that benefit from the ongoing direct input of parents and families, right, which is something that is often done more easily closer to the local level? And what are functions that benefit from consistency and a sort of supportive backbone where only the state can really step in and do it? It's worth noting that on many of the functions, there will be both a local role and a state role potentially, and sorting that out is an important part of the process. The question of who has authority for which decisions, and again, if you're at the state, giving authority to locals means that communities are going to do different things and that has to be okay. There is an important state role here in supporting communities that have the most limited resources. And one of the things the report talks about is the danger of looking at model communities and then assuming every other community can meet that standard, particularly in a world where we're increasingly talking about equity and racial equity, that the state has an absolutely critical role to play in making sure that communities have the support they need in order to be successful in whatever role communities are carved out for. And again, that's a very important part of this conversation. I would also flag here that one issue that came up a number of times is IDEA and special education. This is an area where there is a federal to state to local dynamic. And for, as most of you I think know, special education is required for children under the age of 5, and that school districts play a particularly important role in some of that work. But that making sure that that is well established is also key. In some states, IDEA spending may be greater than state preschool spending on children birth to 5. So it's absolutely important not to overlook that piece of it. So in talking about the local role, one thing that was a consistent theme is that there are many communities and states where there are local collaborative structures that are used for decision making. Again, Louisiana is a state that has used that model, and that there is a key state role in establishing those structures and setting what their authority is. That can include, but doesn't have to, defining the role of key participants, or at least defining which key participants are going to be at the table. Right? And I've identified some of them here. That is definitely not meant to be an exhaustive list. For local collaborative structures to be successful, they need capacity. These often don't go well, and that's particularly true when they are unfunded mandates where the state is saying, that communities have certain responsibilities but are taking no responsibility for supporting that work. One other concern that came across is that sometimes local collaborative structures can become essentially incumbency protection programs for if whoever are the providers who are strong in a community at the time a collaborative is formed, if they take a leadership role, that can make it hard for others to get new space. And going back to the change versus status quo challenge, like that's something that states definitely need to play a role in helping to navigate. And so it's important to think about what are the accountabilities and flexibilities that should be housed at the community level, and what's the capacity needed at both the state and local level to manage that successfully. The state-local relationship will always be one of push and pull, and it can also be one of collaboration. So thinking about what is the right role for the state in supporting these local efforts. For states to be successful at that, or anything really, requires multiple different kinds of state personnel capacity. Political leadership, and certainly you've heard today from a couple of great political leaders from states, but this can include governors, legislators, agency heads, people who operate in a primarily political environment, and those folks are absolutely key. The ceiling on what you can accomplish without them is pretty low, but they are necessary but not sufficient, because for programs to actually be successfully executed and serve the field well also requires strong managerial leadership. And there is often a real tension there between the imperatives as perceived by the political leaders and as perceived by managerial leaders. It's also often, frankly, a totally different skill set, right? Many of us on this call and in the field have known outstanding administrators who work in state agencies and do an excellent job of managing their programs, and that skill set is different than the one that leads someone to become a state legislator or even an agency head. So managing those tensions is key, because a lot of times these managers are caught between the reality that they see on the ground and what their bosses are asking them to do. Then there's also the question of staff capacity. And if the state has a defined role, are there anything near the number of bodies needed to successfully execute that role? And if there are do those bodies actually have the skill to conduct that role, right? And there are a number of issues relating to state hiring practices that may make that challenging. Or one of the other things people talked about is that sometimes states try to hire people who are real experts from the field, and those people remain experts in the subject area, but don't always adjust all that well to a role in state government. So the next slide talks a little bit more about some of these other tensions, right? Getting engagement from the governor and agency leaders can be a challenge. They have so much else on their plate. The tension I noted between political and managerial mandates, and the challenges for division managers. Interagency collaboration is also a challenge here. And the idea that no matter what kind of early childhood agency you have, there will always be work that it is doing that intersects with other agencies. How does that get done? And is that perceived as a priority? And is there support for that work? And certainly, again, the adequate staffing piece is key. This is both a design and capacity challenge that states have wrestled with over the years. So the next slide talks about some of the final ideas in dealing with personnel capacities. One is that some states have established public-private partnerships, and those look a few different ways, but that have housed some capacity sort of quasi inside state government in ways that give it more flexibility. Again, there's a lot of different variants of that. I wouldn't say this paper is anything near an exhausting search, but that is something to think about as you're establishing this. Worth also noting that one of the struggles that came up in multiple states is the idea that there are hard truths about the system that are very, very difficult to confront, and that no individual is really, there may be situations where no individual really feels safe bringing those things up, either because they don't feel like they're senior enough to make a difference, or because they are senior and they feel a lot of pressure to act like everything is going fine. This is not a problem unique to early childhood or even government, but it is a real one in our field, especially given some of the challenges we face. And coming up with a structure that is better equipped to deal with that was definitely a theme of the project. Relatedly, the idea of data and analytics, and Representative Kagi talked about that, the idea that there is so much going on out there, Superintendent White talked about it too, that there's so much going on out there that we don't actually know or understand. How are we building the capacity at the state level to know it better and understand it better and then act on it? This gets now to the next question, which is one that a lot of people find the sexiest, if you will, and the question of how are you going to arrange yourself at the state level in an agency configuration? There are some important considerations in that. First of all, in some states, they think very much of birth to 5. Other states talk a lot about birth to 8. That has an impact on what kind of structure you're going to want. And also going back to the beginning, the question of are you talking about early education and care, or are you talking about something more comprehensive? And again, you can look at Washington as a state that started with one and then moved to the other. There are a lot of state contextual factors that also play in here. One is this notion of creating elevated leadership and the idea of who is going to be a spokesperson for the field. Do you want to have an agency head to fill that role? Some states have smaller agencies that are very effective and independent agencies that are effective. Others, perceive that big agencies are more likely to be effective. That is something that, again, is very contextual and has to be wrestled with. And the idea of state level decentralization. Some states have worked hard to move things closer to communities, even if they are technically part of state government. And thinking about how you might want to go about that is a key part of this consideration as well. So on the next slide, it talks about 3 models of state governance in early childhood. And I would note here a couple of significant efforts to catalog these. I was part of one back in 2013. That's obviously pretty outdated. The Bipartisan Policy Commission did a great report a couple of years ago that talks about a number of these issues. And Education Commission of the States is now working on an inventory. But the 3 basic models are coordination, which is basically where you have programs in multiple different agencies and you just make some effort to coordinate among them. Consolidation, which is like Louisiana, when you put multiple different programs into a single agency that has a larger, also has other responsibilities, and then creation, which is when you create a new agency just for early childhood. So in coordination, there are some states, and I've listed Hawaii, Illinois, and Kentucky, that have created specific governor's offices that are meant to help facilitate coordination among agencies. Again, those are generally facilitative. They don't typically have direct authority in a coordination model. Consolidation, you can see that there are states that have consolidated in different ways. There are some that have consolidated into an education agency, others that have consolidated into a human services agency, some that have changed over time, right? Arkansas used to be in the human services agency and recently moved into education. One of the perceived advantages of this is that you do get that unified vision and operations by having everything under the same roof. There are some significant considerations in choosing a host agency, which the paper talks about at some greater length, but that to briefly summarize, the question of audience is really key, right? There's a perception out there that in many instances, state departments of education are going to be better at dealing with K-12 school districts and the education community, and that social services or human services agencies will likely, it'll come more naturally for them to deal with private providers. Those aren't universally true, of course, but that is often the perception, and that's something that states need to wrestle with. Finally, there are those states that have created their own agencies. Alabama, Georgia, Massachusetts, New Mexico, and Washington. With New Mexico, the newest addition to the club, that agency literally is coming live today. They, like Washington, had a ramp-up period, but today is the first official day of New Mexico's department. So if any of the folks from New Mexico are on, congratulations. So whatever the state's configuration of governance, there will be a need for connective tissue across agencies, as I mentioned. That is something that requires its own capacity to manage. And historically, that's been something where when there is federal support for that capacity, it gets done, and when there isn't, it doesn't. That's not 100% true, but it's been true in some states. It's also the case that gubernatorial leadership is really key here. Not that governors need to be personally involved in the collaboration, but that they can set the tone and set a direction that others follow. And if people perceive this as important to the governor, it makes a big difference. Similarly, it's important to think about collaboration both as inside outside and inside inside. There is real value in having collaboration between the folks inside state government and advocates and providers from the outside. That is not to the exclusion of the need for some space within government for the folks in government to have their own conversations about how they're going to work together. And there are different states that have taken approaches that essentially incorporate both. So one of the things you've heard touched on already is the idea that if you decide to make a change, there is going to be a change management process, and that is hard. This is something that requires engaging the entire field. You've got to manage the process within state government, and there are a few different aspects of that. One is that there are just a whole host of practical challenges, right? What are your human resources systems, your IT systems? But then there are also cultural challenges. These folks are coming together from multiple different agencies where they may have had very different cultures, and even different divisions within existing agencies can have different cultures. How do you unify that? And then the challenge of actually breaking down the silos. One of the quotes that stuck with me throughout this presentation was the idea that one person said that in their state, that a governance change had led to moving the silos closer together. It is definitely the case that bringing divisions into the same agency does not mean that they're going to work together effectively. That takes resources and support. So this is something where, again, you've heard this already a little bit from Representative Kagi, that philanthropic partners can be hugely helpful in supporting change management. And that there are other things you can do, consultancies that can be brought in who have expertise in this. This is something that is not easy in any field, particularly state government. So what kinds of supports can be brought to bear on it? You also heard from Washington about the nature of their timeline. And again, the idea that this is something where on the one hand, you want to keep momentum and maintain a sense of urgency, but on the other hand, it is a lot of work and you're not going to be able to do it all overnight. In part for that reason, you have to anticipate that the work is going to evolve over time. This is something that I think the most successful states have done. And again, in Washington, the evolution ended up leading to another major change, right? You don't want to be going through major changes all the time, but after you've made a major change, you have to anticipate that there will be certain things you couldn't have predicted or that you didn't get quite right, and you have to leave space for those to evolve over time. So having gotten to the point that you've put all that out, you have to decide, do you think it's worth it? And there are some things that, from talking to the states that have made changes, that are worth flagging for consideration. One is this need for high-level leadership, right? Is that an absence in your state, and is it something that you think a governance change can help you address? Recognizing that no structure is going to solve all your problems, and that moving programs isn't the same as fixing them. How are you building that capacity? Role definition is key, right? I mean, you're much better off with an imperfect structure where everyone at least knows what they're doing than a sort of better on paper structure where no one knows what they're doing, and that states have talked about the experience of dealing with that reality. Political symbolism does matter, right? There are definitely a number of advocates and people who talked about to them, the idea of having a standalone agency or, you know, a very prominent unit within an existing agency is a sense of arrival, right? That it shows that early childhood is a big deal and has its own political heft behind it. As flagged earlier, the idea that the status quo has a cost, the cost of transition is real and it has been intimidating to the states, but there is also a significant cost to the status quo. COVID-19 in some ways has driven that home and made that easier to quantify, and that needs to be brought to bear and create some action imperative. Do not let perfection be the enemy of improvement. There is no perfect system, and there's definitely never going to be agreement on a perfect system. So, you know, in a lot of states, I said, look, like, we thought that what we could change to would be better than what we had, and we went in that spirit. And again, part of that is allowing the process to be dynamic over time so that whatever you learn from the experience, you have an opportunity to apply. So that's a lot, obviously. In thinking about what next steps for the field there may be, one is of support from the federal government, and this is not to say that the federal government should be dictating any particular results, but that it has been the case that federal grants have been really useful to states as they have done this work, dating back to State Advisory Council grants and the Early Learning Challenge, and continuing now through PDG. So again, that's not necessarily a call for dedicated money focused on this, but a call for some amount, you know, some resource to support the process for states that are interested. There's been a lot of leadership from national organizations on this. I'll cover that a little bit more on the next slide, but they have supported in-depth engagement for states that have wanted deeper help, and also created peer-to-peer learning. And a number of folks in different states talked about that talking to their counterparts in other states was a hugely valuable part of this. The need for a research agenda, you know, there's a lot we don't know about the impacts of governance on child outcomes. And in fact, that was one of the questions we got in advance. The reality is there isn't a lot of research on that. And the question of, is there a research agenda on governance that could help us understand its impacts in a more sophisticated way? And again, philanthropic support. There are a number of places where support from philanthropy can be really helpful, particularly in a change management process, perhaps, where, again, you're talking about a one-time investment for a potentially long-term impact, which for a lot of philanthropies, they see as a valuable opportunity. So those are some of the key things that I wanted you to know about this. I do want to thank everybody who was an informant to this process, and all the folks who reviewed drafts of this, of which there were multiples. They did yeoman service, and I am really, really grateful. And I know several of them are on here today. There are a lot of organizations that have done really important work in this area. I've highlighted some of them on the slide. I know that's not all, but that it's worth noting that they are a resource in this area as well. I mentioned earlier some of the work that ECS is doing. And as I said, this is a difficult moment, but it's an important one. And we do have a real opportunity to think about things differently, and an action imperative that we might not have had before. Not that we wanted to get here this way, but now that we're here, I think a number of people I talked to recognize that the chance to do better at early childhood governance is an important opportunity of the next few years. So I will stop there and leave it to Rebecca to offer some final reflections.
Great, thanks, Elliot. Thanks to Representative Kagi for the Washington perspective, and to Superintendent White for the perspective on Louisiana, and then on this issue more broadly. Deep thanks go to Elliot for the tremendous amount of work that he did to pull this report together. I think he conducted over 70 interviews of state and national leaders for this, and I think it's just tremendously valuable to capture that all together in the report. So I appreciate that. For those of you who don't know me, I'm a program officer with the Heising-Simons Foundation. Our education program is focused on early childhood birth to 8 with an explicit racial and income equity lens. And a part of how we hope to achieve our grant-making goals in the long term is through systems change and policy change. And a part of that includes a strategy that focuses on state-level approaches to early childhood governance. This is relatively new for us. We've gone through a strategic planning process recently, and some of Elliot's work in early stages of this work informed that strategy. And I would also say I, prior to joining the foundation, conducted some research on governance in states as well as internationally, and I worked in 2 state systems that had very different approaches to governance. And in Pennsylvania, in the early years of the Office of Child Development and Early Learning, and in New Hampshire, which has a quite fragmented and decentralized approach to governance. So I've done a lot of thinking about this from a variety of lenses. And I think what I'd like to do is to maximize time for Q&A. I just wanted to lift up 5 or 6 themes and tensions that I heard in listening to the conversation and that are reflected in the paper that Elliot wrote. And I think the first one is that context really matters, right? And so we live in a federalist democracy, and there's no one right solution to governance of early childhood systems, right? It's going to be very grounded in the political, economic, and cultural context of the state. And so what is right for Pennsylvania, for example, would not be right for New Hampshire. And I think we see that in the different state approaches, struck both in terms of structure and function, that have been lifted up. I think it is important to continue to study those approaches because, as several speakers have mentioned throughout the call, it's really useful for states to learn from one another, and for within the state, for different constituencies within the state to learn from one another. So I think, when we think about context and culture, that's an important consideration, and it's something we should study over time. The second point that I want to make, and this is something that all 3 of our speakers really, I think, hit on very concisely, is the notion that if you're thinking about a governance reform, it's important to have a theory of change and a set of outcomes, coherence perhaps being one of them for the early childhood system. I also think, when we think about outcomes, we need to more explicitly than we have done as a field, think about how white supremacy has played into the policy structures that we've created and the outcomes that we've identified for kids, families, and the workforce. And we need to think about approaches to governance that are actively anti-racist. So I think we've gone down the anti-bias road as a field, but we can really do more thinking about how we can create governance approaches that are anti-racist and that dismantle systemic barriers for, in particular, Black, Indigenous, and Latinx children, but all children of color, and also children and families living in poverty. So I think that's something that is maybe on the leading edge of governance, something that I heard our speakers touch on in different ways, and something that we probably need to do a lot of grappling with as a field. The third point I wanted to make, and the theme that I heard, is around partnerships. I think there's a lot of room for partnerships when you're thinking about governance. One of the partnerships that was lifted up is the role for philanthropy, and in particular, Elliot in his report cited the role of state and local philanthropy in supporting state governance approaches. I think there's also, of course, a role for national foundations as well. But sort of thinking about what the right types of partnerships are there is really important. And we've seen lots of states engage in governance reforms where philanthropy has been an important partner. Washington, of course, one of them. That was also the case in Pennsylvania, and there are a few other states that we could talk about, my current home state of California being one of them. But I think we need to think about other partners as well. There are states where advocates have been instrumental in getting the governance reform passed. Our speakers talked about that. Massachusetts is another example of a state that was led to their governance reform really by advocates. And a place where I think we could engage new and different partners is thinking about the role of grassroots organizers. So when we think about family and community voice in governing, right? The goal, I think, of government and governance in a democracy is to meet the needs of constituents. And so how do we design approaches to governance that are really responsive and engage in more than a tokenistic way the populations that they purport to serve? So I think this links back to my comments about racial equity and dismantling white supremacy, but it also could lead us to new fruitful partnerships with grassroots organizing groups. And then I think the last comment that I'll make is around sort of capacity and scope. So I heard all three of our speakers touch on this, is like, again, if we're thinking about designing approaches to governance that meet the needs of the constituency in any geography, that will mean the structure will need to be imbued with different functions, and that might change over time, right? So the scope may expand or contract depending on the needs of the community, and that will render the need for different capacities. And so as we think about not only political leaders, but administrative leaders, what are the capacities that we need to be thinking about as we develop a pipeline of policy leaders that are important to effective governance, right? So who are the people who will be managing these governance approaches, and what skills do they need? And then, of course, we need to be thinking about representation in those leadership positions. So how do we think about diversifying those leadership positions, for example? That will help us get new perspectives on governing. So I'll stop there. That leaves us with maybe 20 minutes for Q&A. And I appreciate, again, Elliot's work. I appreciate Representative Kagi and Superintendent White for your great thoughts and the state perspective. And thank you for the opportunity to give some closing remarks.
Well, thank you so much. And again, this obviously wouldn't have happened without you, and really appreciate your leadership throughout the process. So we've gotten some questions in the comments, including some, one that has been sent to everybody and a couple that have been sent just to me. So let me start with the one that was sent to everybody from Professor Smith, and it's addressed to Representative Kagi, but John, I'd love it if you would give your response as well. Talking about what changed the minds of Republicans in the legislature, and would those arguments be convincing in other states? And also, and this is a good follow-up, about the need to convince relevant agencies that creating a new department would be a positive change to the system.
I can't overstate the importance of business leadership in working with Republican leaders in the legislature. We had some key business leaders who had looked at the research on early learning, had met with Art Wolnick, really understood the economic argument and the argument about getting children to school so that they could succeed. And that kindergarten readiness, the legislature was spending a tremendous amount of money on remedial education when children got to K-12. So that was one of the arguments that was very compelling. And just the issue of coherent management and structure that John talked about. We had a totally incoherent structure before we created the Department of Early Learning, and there was no way to know, what one hand was doing and the other hand was doing. So I think those things combined were very helpful, but I also believe that the science and the research played a real role in Washington in convincing legislators. When Dr. Pat Kuhl came and gave a presentation on early childhood development to the Appropriations Committee, and showed pictures of these little babies, with bonnets with all these electrodes on them, it really, and the impact of that early development on school readiness, it really started changing people's minds. And some of the Republicans started to realize that investing in those first 5 years, that there was a role and it was important.
Yeah, I concur with all that. I really agree with the last point in particular that, in my experience, what makes sense to Democrat legislators as a matter of science and reason may not be exactly the same arguments, but it's of the same nature that makes sense to Republicans. They too have a desire to see things improve, and it may be the same as yours or mine, but it's typically one that's grounded in facts and logic. However, I also think that there is this kind of chance to enact what I'd call a pluralist reform when you do this. And I think that governance offers an opportunity to create a big tent. I mean, in a sense, governance is the tent. And you have a decision to make as a state as to how large the tent you create is when you reform governance. I think for reasons that probably all things considered are well intended, especially from a social justice perspective, but I think actually can end up creating greater levels of prejudice and stereotyping. Early childhood is largely perceived to be and is in fact a service that is exclusively focused on the poor and the very poor. And in Louisiana and across the South, that very largely means you have a service that is not exclusively, but very largely African American in those it serves, and not white in those it serves. And that cuts across lines of party, it cuts across lines of race and socioeconomics as well. And so what you can end up with is a kind of acceptance that this is a Democrat issue for people of color, for the working poor, and never stopping to realize, wait a minute, there's actually a much bigger tent, both as a humanitarian mission, but also politically, that could have been created here. And that too can cut across different lines. I mean, just to say this outright, the Catholic Church is an enormous provider of childcare and pre-kindergarten services in the state of Louisiana, and by the way, has been doing it for quite a much longer time than the government is doing it. Now, whatever one's orientation toward public subsidization of religiously based services, healthcare, education, or otherwise, it is true that they are a helpful actor when you're trying to convene a pluralist coalition. And I would also, by the way, say that in those environments that do not have universal funding, we really need to look at those parents, those families who you could call middle income parents or families, you could call working income parents or families, and we need to ask ourselves, are we well served making the case for something that looks more like universal early childhood care and education by so exclusively focusing on a relatively small segment of our populations by way of very, what I would call clunky means tests. So, I say all this, Elliot, just to say that I think the question about how we bring different people of different persuasions in to care about this issue is, yes, I agree, principally an issue of reason, logic, and good arguments. But I also think there's an art to creating a bigger coalition, and we as policymakers have not done a great job in the early childhood setting, creating a big tent with the policies we've enacted.
Elliot, I'd like to add one more thing. I do think that COVID-19 offers an opportunity to engage the business community at a much higher level. Businesses are really struggling because they can't hire people because people can't find childcare. And that was true before COVID-19, and now it's really accelerated with the closure of many childcare operations. We have found, I actually have spent a lot of time in the last year going around talking to chambers of commerce about the childcare crisis. And businesses are really paying attention, and I think they can help be part of the solution.
I think all that's right. And I would just add that in the course of my research, that it didn't feel like there were radically different answers that I got from people in quote unquote red states versus quote unquote blue states, that a lot of the issues in this were really cross-cutting, and that there is an argument for efficiency that, and coherence that really, was meaningful, in multiple different kinds of political environments. So, I mean, again, some amount of that is contextual. I do want to pick up on the second part of Professor Smith's question. I'll just say that with regard to convincing relevant agencies that this a new department would be a positive change, sometimes that's important, sometimes it hasn't been. Has been what I've seen is that, if this is an issue that the legislature takes hold of, that, and also governor's offices, they are sometimes willing to do this over the objection of some of the agencies involved, and that those political fights can be super contextual, but that unanimity among agency heads has not historically been the standard for this, and that there are often, when changes get made, at least some hard feelings on the part of one or more agencies. Worth noting, one of the quotes in the report is that if a division gets moved from one agency to another, chances are that it's going to need to maintain a positive relationship with the agency it just left, and that's a key thing to consider in how you structure the process as well. Another question that we got, and I'll maybe take this first and then ask Representative Kagi and Superintendent White to weigh in. A question about, has there been an estimate of the glue money needed to create a new agency, and what it costs to maintain infrastructure that larger agencies have, and the danger that people will consider this a cost savings. So, and I think that this is a really interesting question, and one that I think is highly, highly contextual. The question of what kind of money do you need to run the new agency looks really different from place to place. I think Representative Kagi touched on that, and that in the initial creation of Dell in Washington, they didn't give it enough money to operate, but that on the, with the Department of Children, Youth and Families, they tried to do better at that. One of the sub-themes that came up on this was that childcare funding is often more administratively flexible than some other forms of funding, and that there are some states where the agency that has primary childcare funding has essentially used that to subsidize a number of different administrative costs within the human services or social services agency, and that moving childcare to an early childhood focused agency runs the risk of disrupting that infrastructure. That is not a universal issue. It's one that some states are undoubtedly going to come across. But I would say this is perhaps a great example of where federal or philanthropic money could make a huge difference, because again, my take would be that the best way to address this would be to commission a state-specific report to look at exactly this question, to make sure that whatever is going to happen in that state, there's information and a plan accordingly. But Superintendent and Representative, I'd be curious for your take on that.
Well, I would, this sort of ties together a couple of the points you made in response to the last comment also, and it's really only to say that ideally, and we didn't create a new agency per se, but we certainly didn't entirely understand the ramifications of moving the licensing function out of one agency and into another, less from the perspective of would it be better in terms of offering services to communities? Yes. But from the perspective of what type of backlash would it generate and what was the source of that? And I think a lot of that, frankly, was we did not appropriate additional monies to smooth the transition, and I think that could have been done. And secondly, we didn't really know where the bodies were buried in terms of how funding streams like CCDF or TANF had been allocated across these agencies to subsidize different functions, so that when they were taken out of those agencies, all of a sudden a bunch of people were kind of left wondering whether they had a job any longer. I think probably we could have done a better job accounting for that. Certainly additional money to lubricate that transition is really useful, and it's something that should be accounted for on the front end.
Well, certainly cost savings should not be a lead argument for creating a new department. It is the coherence of governance and policy formulation and budget, I think, that are the primary arguments. And I think the costs are very individual by state. The Blue Ribbon Commission spent a lot of time analyzing what the costs would be. And then when we actually passed the bill, the secretary was given the responsibility to come up with an estimate of the costs and a plan for implementing. So it's been staged, and we haven't fully funded the costs of the infrastructure. I mean, we still have enormous data system issues. But there was robust funding to, particularly for the Office of Innovation, Alignment and Accountability, and some of the other core functions. But I should mention that the eligibility and payment system for childcare just moved over last year. That was the last piece, and the department discovered they really couldn't develop a coherent governance and policy structure, having that eligibility over in DSHS. So it's an evolving story about how you make this work effectively.
All right, so we're coming to the end of our time, and I'm gonna put on the table one last question, which I will ask and then provide some thoughts on, and then Superintendent and Representative would turn to you to add anything. The question was about what are some strategies for gaining buy-in when you don't have leadership leading the effort? And this is something at some point in my report, I cite to a case study that was done in Massachusetts, which is in some ways the most interesting example of a state doing this despite the lack of gubernatorial leadership. In many states that have made meaningful changes, the governor was at least on board, and in many instances a key driving force. I do think one of the things that we've learned from different states is that, first of all, leadership can come from a number of different sources, right? Obviously, if a governor is driving it, that is helpful because the governor has so much authority, but that's not necessarily required. And that there have been state superintendents, including both elected and appointed ones, and legislators who have forced this issue onto the table. One strategy that some states have talked about is the idea of that if you don't have gubernatorial leadership, how do you make this an issue that a governor can take on? You know, can you get advocates together and put together some plans that, you know, when you get a more favorable governor, that governor might pick up? And, you know, I know some of the advocates from New Mexico were able to join us. It's worth saying that the advocates in New Mexico did a number of reports on early childhood governance, and that when a new governor was elected, that governor articulated this as a priority, and that's when the change got made. So again, my read on that situation is one where everybody had a role to play. Obviously, having a supportive governor was absolutely essential, and the governor's leadership has been key, but that the advocates created conditions in which that was easier for a governor to do. And particularly in states with term limits that, you know, at some point you're going to get a new governor and can think in terms of what are you going to do to get ready for that new governor when that new governor comes. Representative and Superintendent and Rebecca, anything more any of you want to add to that?
Well, that's extremely well stated. Governor Hunt came to Washington when Chris Gregoire was running for governor and told the story about how business leaders came to him asking him to provide strong leadership on early childhood education. And so it became his signature issue, and Governor Gregoire picked that up and carried it with a lot of input from the business community. So I think you can convince a governor, particularly when unexpected voices like sheriffs and police chiefs or business leaders or teachers come forward and really make the case to them. But I also think leadership can come certainly from the legislature or from an agency director. I mean, legislators every day are pushing issues that the governor doesn't have high on their priority list, and they can force big change. You need a champion, for sure.
Totally agree. And I think right now, this issue is really at a high watermark. I mean, there is a kind of consensus emerging on the issue, not necessarily with the level of specificity we might want, but it is a consensus issue. And I think it takes courage just to step out at the right moment. And if the governor won't do it, somebody can do it. I think mayors are good spokespeople on this. And that's why I think acknowledging that everything we've discussed can happen at the local level. Ideally, it happens at the state level. The state offers scale. The state also offers the ability to kind of make people do stuff. But, cities and counties can do this on their own also. And I think we should support leaders wherever we find them and encourage not just governors, but also mayors and county commissioners to step up and lead on this, as well as local school district superintendents, by the way, who we don't frequently enough ask to be leaders on this issue because we believe that they're taken up with their own K through 12 resource issues when this is every bit as much a part of their education system. So every person who can help should be on deck.
Great. Well, I want to make sure we end on time, and so we are going to do that. Thank you very much to all of you for joining. I really appreciate you taking the time to be a part of this. If you have any questions, comments, follow-up, please be in touch with me. My email should be in the report and the materials, and I definitely look forward to hearing from everyone. Mostly stay healthy, stay safe out there. Thank you all for the important work that you're doing. And again, thank you so much for being a part of this event today. Take care.